All right, with all the holiday parties and events happening this time of year, we can eat lots of different foods and drinks, but then it can sometimes cause heartburn, and that is no fun. And joining me this morning is Dr. Brooks Cash with UTHealth Houston and Memorial Hermann to talk about what we can do to prevent it. Good morning to you.
Thank you.
Why is it worse this time of year? I mean, we eat a lot of these foods year-round.
Yeah. Well, we tend to overeat this time of year.
That's true.
And we tend to eat late at night and then lay down and watch football or sports and, you know, just recline. So all of those things contribute to increasing the risk for reflux and heartburn.
Well, you brought in a nice display here to give us an idea of some of the ones that we might want to think about not overindulging. Starting with wine, that can cause a problem?
Yeah, well, just alcohol in general.
Okay.
You know, the reason that people get reflux is that there's a little one-way valve at the bottom of the esophagus, and these types of foods, spicy foods, tomatoes, alcohol, chocolates, caffeine, all can help lower that, we call it a sphincter pressure, and that allows gastric contents and gastric reflux to occur.
All those foods everybody loves.
Oh, yeah.
Doors, you're talking about things that are spicy cause a problem?
Yeah, spicy foods, peppermint tea. We've got peppermint tea here. Peppermint is the culprit there, but also the caffeine in the tea.
Okay.
Coffee, chocolate, as I mentioned. So all of these things tend to increase that risk for heartburn, regurgitation, and people feel really lousy after they eat them.
I think when you just hear the word heartburn, it comes to mind what it feels like. You picture this burning sensation in your chest, but what are the typical symptoms if it's just heartburn?
Yeah, so heartburn falls under the category of what we call GERD, or gastroesophageal reflux disease, and the two cardinal symptoms of GERD are heartburn and a sense of regurgitation. And people will sometimes have both of those symptoms. Sometimes they'll just have one, and they'll come in and they say, I feel a burning in my chest, as opposed to I feel an elephant sitting on my chest. That's a little bit more concerning about cardiac disease. But those are the typical symptoms of GERD, and we need to deal with that if those symptoms occur frequently, because it can cause some long-term damage and have some long-term risks.
Yeah, and with it, let's talk about the treatments. Antacids are all over the market. Is that a good idea? And then should you not think about doing those long term, because that can even end up causing problems, right?
Yeah, antacids are fine to use intermittently. Even once a day is fine. But if you're having symptoms at least once a day, you know, that's a sign that you really need to talk to a healthcare professional. And we typically will use a threshold of symptoms at least 3 times a week. That really you should need to talk to somebody about that, because there are better medical therapies that can reduce acid reflux.
Let's talk about the next step. If it's something a little more dangerous for you than heartburn, how would you tell the difference in that?
Well, typically what we'll do is when patients come in complaining of these symptoms, and especially if they have symptoms like food feeling like it's getting stuck, or if they actually throw up some blood, or they start losing weight, or they even have a family history of esophageal cancer, we need to see them, and typically we'll do an upper endoscopy and take a look with a camera down their esophagus.
And as we take a look at this list right here of reasons you might experience heartburn, so it really could be something more serious than just overeating, it looks like.
Absolutely. We don't want people to ignore these symptoms, because A, it significantly decreases their quality of life, but as we saw on the list, there can be some more worrisome things that are present. We need to evaluate those and then treat them if we find them.
Is it fairly easy for you to figure that out, or does it take a whole lot of testing?
It usually is fairly easy. Of course, every patient's different. Some patients, they are more difficult to diagnose, but generally we can figure that out very easily, and then we can give them effective therapy.
So many times, especially during the holidays, I think we hear that moderation is the key to all fine things in life, right? So is that your key here, just to sort of take it easy, enjoy what you can, but maybe just not overdo so you don't end up in pain?
Exactly. Eat slowly. Eat less. You can always go back if you want to, but and then the other thing that we really highly recommend is not eating and then laying down. Gravity is our friend in terms of our digestion, so you know, those types of behavioral modifications are important.
I picture you all on, you know, Christmas Day, and you're stuffed and you want to lie down. So how long should you wait before it's time to go lay back?
Yeah, generally we recommend about 2 hours.
All right, you heard that,
down.
everybody. You got to sit up for a while. All right, thank you so much for coming in from UTHealth and Memorial Hermann.
Thank you.
Nice to have that advice. Let's keep you feeling good.